Science is defined by the accumulation of knowledge over time through the systematic observation and gathering of empirical evidence. In the life sciences, as in other scientific disciplines, each new finding is built upon a foundation of generally accepted facts that have been vetted by researchers and disseminated in the literature for other scientists to reproduce. But what if the majority of the facts published in the literature are not reproducible? What would that mean about our state of knowledge in the life sciences, and how would it impact our search for the cures to diseases? The issue of reproducibility in science has gained a lot of attention over the past few years, and for good reason. The very foundation of how biomedical research is performed is being called into question. Currently, the workflow for science has involved the close interactions of 6 different stakeholder groups. Researchers, who are responsible for formulating a hypothesis and designing experiments to test it. Suppliers, who provide reagents and equipment to help perform those experiments. Professional societies that foster collaborations and help disseminate information amongst researchers through conferences and posters. Publishers, who are responsible for assigning reviewers who scrutinize the research to decide if it is worthy of entering into the written record. Funding agencies that prioritize which research is worth pursuing by granting scientists the resources to continue their work, and institutions, both in the private and the public sector, where this research is taking place. These stakeholder groups together form the life science community. But the pace of discovery for this entire enterprise is dramatically affected if a large percentage of the research that is disseminated is not reproducible. So how big of a problem is the issue of scientific reproducibility? And what, if anything, can be done to address it? Here we will take a deep dive into the problem of reproducibility in basic research to examine some of the root causes. In particular, we will focus on the role of one ubiquitous reagent that has been implicated by many as a significant contributor to irreproducibility: antibodies. In recent years, these powerful, highly versatile proteins have been proven to be extremely effective as therapies for a wide range of diseases. But their use as a research tool goes back for decades, and they have helped researchers push back the boundaries of science. But their widespread use and misuse in research labs may be contributing to the irreproducibility issues the life science community is currently facing. We will talk with representatives from key stakeholders in the life science community to find out what they think are the problems and the possible solutions to the reproducibility crisis.
The most important thing to realize about this whole set of issues is that no one stakeholder group can solve this. NIH alone can't solve it, investigators alone can't solve it, journals alone can't solve it, institutions alone can't solve it. We're all in this together.